Hi everybody, it's Dr. Tauquir Ahmad here from our clinic in Glasgow, and today with me I have my lovely Jackie, and we are in the midst of the process of treatment Jackie just now. So what we have done is we've done a partial lift up here, but we've got more of a lift to do, where we are going to lift you up here. But the other issue we've got is we've got some volume loss here. So we've got some mid-face revolumization, and what I plan to do is replace the lost fat pads up here, just to replace some of that lost volume here and here, and that automatically will give you a lift out here and help with this area here and here. We'll let that settle down for about 2 weeks or so, and then bring you back in, and then what's left for your thread wise, we'll pop it up and that'll finish off the whole treatment, okay? Perfect. So we'll get that shown now. My choice of filler today I'm going to use is, we're going to use a Tauquir for deep for this area here, and then maybe for the areas around the sides we'll be using RHA4.
Okay.
Great filler, lasts for ages, and it's safe.
Okay,
Thank you. Okay, so I don't know if you can see, we've injected one side here, but look at where that jowl area is sitting here, and look at where that area is sitting in there, and that's just with the revolumization. So what we've done is replace the lost fat pad in there. In there we've lost the fat pad that's there, and that fat pad that's deep down acts as an anchor. So this is not about putting filler in for big lips and big cheeks. This is about restoring a lost anatomical feature. And by doing that, we've taken the skin back to where it was supposed to be. So when we age, the skin sags from the side and we lose volume from the middle. So by replacing the volume, we're able to lift up, and then by popping threads in at the side, we're able to lift up as well. So we've now done the volume replacement. We've seen the impact that it has had up here. We're going to do the same, and then we'll see the results afterwards. Thank you.
Oh my goodness. What a difference, isn't it?
Do you like it?
Yeah, I do, thank you. It is, it's like taking all the bits away as well.
Yeah. So when you're in next time, we'll then finish off with a lift at the sides. Is that okay?
Mm-hmm.